Are you having surgery soon and you're nervous, worried, clammy, and just are totally afraid to have surgery? Well, today we're going to talk about pre surgery anxiety and what are some of the tips you can do to calm yourself so that you can have a successful surgery. Pre surgery anxiety is very common. I've had surgery and I've been on both sides of the bed as a patient and a surgeon. And so I know what it's like to undergo surgery. Today, we're going to talk about some of the ways that you can relieve your stress and anxiety so that you can have a successful surgery. If that sounds good to you, continue watching. Welcome back to my channel. I'm Dr. duPont. I'm a board certified gynecologic oncologist, and I'm passionate about educating women and how to live healthy and longer lives. And I believe that begins with great health. Well, I was reading the comment section of my YouTube channel, and I've got a lot of questions about anxiety and fears and worries. And I want to thank you guys who've, consoled each other, that have encouraged each other. And when I read the comments, it's just amazing that sometimes I don't even have to answer them because someone else has already answered them with their experiences or shared some of the tips that they've used to go through surgery. Well, I did do some research on this because I wanted to know, what are some of the common ways people manage pre-surgery anxiety and what are some of the evidence-based approaches? So we're going to talk about those today, and I'll give you some of the tips that I've used as a patient and a surgeon to alleviate your fears and some things I've done personally to help me face surgery. One of the things about surgery is that you have no control of the outcome. I won't say helpless, but you're not able to control what happens, and you're really trusting strangers to take care of you. But just keep in mind that surgeons and the medical team go through years of training, that we're all professionals and this is what we do every single day. And that we know that one day we're going to be a patient. And so we want to take the best care of our patients because we want to one day have those, people take care of us. So just keep in mind that we're professionals and we do the very, very best that we can for you because we have family members that have surgery and we want them to be taken care of as well. So one of the most important ways to reduce pre-surgery anxiety is through education. And there have been a lot of studies that have shown education alone will reduce anxiety in terms of upcoming surgery. And so one of the things that preoperative clinics will do is they'll educate you on what's the process, what time you get to the hospital, what's the process that when you arrive at the hospital, what are the nurses going to do? And so that's very helpful to know what are the steps so that you can be prepared and so that you can plan ahead. Now, some of the things that, I tell patients that I do in my own practice is, talk with your surgical team. Let them know you're scared. Let them know your fears. Let them know what worries you so that they can address that. Because a lot of times, if you don't share your fears, we don't know. We can't read your mind. So share your fears with your doctor and your anesthesia team. They're going to be putting you to sleep. Most of them are extremely nice and, they are very kind and compassionate. Let them know that you're scared. Sometimes they'll give you medicines to kind of calm your nerves once you get to the hospital and you finished your paperwork. But sometimes that really helps when you have a lot of anxiety and a lot of fear. In terms of education, ask questions. What's the alternatives to surgery? What are the complications of surgery? What's the length of surgery? What's your recovery period going to be? What's going to happen when you go home from the hospital? So those are all important things that you should know. And if you have answers to those questions, a lot of times that will reduce your anxiety as well. Cognitive behavior therapy is also gold standard to treat anxiety, but it's also helpful to reduce your pre-surgery anxiety. And you could see a therapist or a counselor. A lot of them now are online, so you can talk with someone before your surgery if you have really severe anxiety. I had one time a patient when I was new in my career. She was so anxious that she actually didn't show up for her surgery. She just didn't come to the hospital. And so it doesn't happen often, but it does happen. So definitely talk with your healthcare team because education is important and cognitive behavioral therapy or counseling is important if you need that as well. Meditations, there's lots of apps such as Calm app. There's many different apps nowadays that can help you, calm yourself down and help you not be so anxious or reduce your anxiety. I love reading the Psalms. I remember when I had to have surgery, I recited the 23rd Psalm. Most people know that Psalm. And so that helped relieve my stress and anxiety. The Psalms are very, very calming to me. So that's something that you can memorize or read beforehand to relieve your fears. Deep breathing exercises. There's lots of different types of deep breathing exercises, but that will also reduce your anxiety and your fear. Music. Music is very soothing to many people. If there's a particular song that you love, you can ask the anesthesia team to play it or the surgeon to play it while you're in the room. So sometimes having your favorite song playing while you're going to sleep will relieve your fears. A lot of times, they can have music in your preoperative holding area, and that will relieve your fears and kind of calm your nerves. And then having family support, having a friend or a spouse or a parent there with you to hold your hand until you go to the operating room will also relieve your fears and anxiety. Massage therapy has been reported to be very helpful. You can have that done, before your surgery. Aromatherapy, you can do that the night before surgery. Acupuncture is very helpful and very calming. You can do that before surgery to just relieve your fears. Prayer is very important and that will help relieve your fears. Hypnosis has also been reported to be one of the ways that you can reduce pre-surgery anxiety. What I recommend is exercise because that's very calming to me. So for patients who are able to exercise, exercise daily in the weeks or so before your surgery to help clear your mind and calm your thoughts. Healthy diet before surgery will help reduce, risk of infection, especially if you're diabetic. And then stop smoking. That'll also help reduce risk of complications. Try to stop smoking 8 weeks before surgery. I know smoking is calming for some people, but it can cause some respiratory complications. So definitely if you could stop smoking, that would be very important. I like my patients to take a prebiotic and a probiotic before surgery to improve your immune function, and I think that helps with your GI health. I like patients to take vitamin C before surgery. To me, that helps with wound healing. And then other things that I have patients do is, make a plan. Prepare your family for things that you can't do. So a lot of my patients, when they're having a hysterectomy, I tell them no housework for 3 to 4 weeks. And so it'll depend on the type of hysterectomy they have. But, have a plan in terms of your meals. Have family members bring meals or just cook a lot of meals and freeze them ahead of time because you may not want to cook after surgery. And we don't really want you eating out every day. So freeze your meals ahead of time and prepare that way. Ask someone to clean your house. You can have a family member do that or hire someone to clean your house just so that you're not worried about a cluttered house. And a lot of women, that increases their anxiety. Do your laundry beforehand so that when you're coming home from surgery, you don't have a lot of things to do. Clean your sheets or change your sheets before surgery so that when you get home, your bed is clean with clean linen. You'll feel better. And then have your family member help with chores. If you have children in the home or if you have friends or family that can help with just routine chores, that would be helpful just to relieve some of the stress and pressure on you after surgery. I like to tell patients before surgery, go to the grocery store and get some common things such as Tylenol. You want to have that for pain, or Gas-X. You have that for gas pain, especially if you're having a laparoscopic surgery. Please see my video on recovery after a robotic hysterectomy to get some tips on how to prepare for that type of surgery. And then ginger ale, 7-Up, or Sprite will also help with nausea. Ginger, hot tea also helps. And then in terms of constipation, prune juice, prunes, stool softeners will help. So having all those things on hand at the house will help. Benadryl is always good to keep around to prevent, allergic reactions or if you're itching because of something that you took. Always good to have Benadryl at home. And then also a heating pad or ice pack. Heating pad's very good for post-surgical pain. Make sure you get one of the newer ones that, turn off after a couple hours so that you don't burn yourself. Because a lot of times after surgery, you may have nerves that are numb, so you may not feel the heating pad. So you want one of those newer ones that turn off so that you don't burn your skin. But heating pad or ice packs are very helpful in terms of soothing after surgery. So that's something that you can kind of prepare ahead of time. Dial antibacterial soap or Hibiclens to reduce wound infection. So having all these things, in place were helpful. I think when people are prepared for surgery, they have less anxiety. So I'm kind of giving you some ways to prepare for your surgery so that your anxiety and your worry and your fears will be a lot less because you'll know what to expect. I do have a lot of videos on several different types of surgery, especially GYN surgery. So if you're having one of those, please check out my videos because I'll give you kind of some tips and tricks and talk to you about the procedure itself. So education, again, is one of the main ways that we reduce your fear and anxiety from surgery. So being well knowledgeable on what's about to happen is important. So if you have any tips that have helped you recover from surgery or helped you reduce your fears, please put them in the comments below and share them with others so that we can all learn from each other. And again, if you're new here and you've not subscribed, please press the subscribe button. And if you like this video, please give me a thumbs up. It helps me with the algorithm. And thank you for watching to the very, very end. And I'll see you in the next one. Goodbye.